Welcome to this tutorial, which will review some common concerns about integrating patient-reported outcomes into clinical workflow and some potential solutions. Some common questions regarding patient-reported outcome or PRO implementation include, what measures should I use? How do I know when or how often to assess patient-reported outcomes? How do I incorporate PRO into my clinic workflow? And what do the scores mean? In this tutorial, we will be reviewing some common concerns related to patient-reported outcomes in the clinical workflow and discuss some potential solutions or workarounds for those issues. Healthcare delivery, whether it's at a community hospital or a large academic health center, has lots of moving parts, and busy clinicians and researchers often have difficulty understanding how they can introduce patient-reported outcomes as part of the regular clinical workflow. One common concern that comes up is that adding patient-reported outcomes into clinical practice changes how people work, specifically for the negative. The concern is that patient-reported outcomes may cause workflow disruption for staff, physicians, and other healthcare professionals that will adversely impact not just the clinic flow, but the patient experience. Some of the hiccups that can occur as part of this process include that staff need to find time to identify if an assessment needs to be done, patients need time to complete a patient-reported outcome, and in many circumstances, a clinician needs to find time to review and potentially act on the results. There are several ways to think about how to minimize the disruption. Perhaps the most useful is to establish a multidisciplinary team to minimize these disruptions. For example, by taking advantage of existing wait times that patients may have to target when patients should complete patient-reported outcomes, or in some settings, it might be possible to schedule assessments as appointments that patients will keep. We also find that it's important to facilitate regular communication among staff to help troubleshoot and identify these potential sticking points. Also critical to help ensure high compliance with patient-reported outcomes is to have a written protocol for patients who do not complete an assessment. Another common concern with integrating patient-reported outcomes into the clinical workflow is that clinicians may not use the patient-reported outcome data or use it incorrectly. This has downstream effects in terms of data quality because we know that patients are more likely to complete PROs if they're used by the care team. Clinicians may inadvertently misinterpret what a PRO score means, making completion difficult or less than useful. We find that some of these concerns can be mitigated by providing interpretation aids. There is a learning curve to understanding this, and there may be some pushback from the clinical teams in implementing these interpretation aids. We find that ensuring that the clinic leaders and champions within the hospital system or service line, having that support be clear is critical. We also find that it's critical for education to be provided on how PROs can be used to prepare for the patient visit, to facilitate or enhance reimbursement, or help in clinical decision-making on the part of the clinician. It's also best practice to help provide interpretive guidance for patient-reported outcome scores, for example, describing scores as mild, moderate, or severe based on established cut points when possible. And in addition to having numeric scores, having a graph with patient-reported outcome scores over time can be useful not just for the clinician, but also for the patients themselves. Workflow disruption can also cause data collection to be less than ideal for other reasons. One sticking point that we have found is that reliance on a single data collection method won't capture all patients. Most commonly, we see this when there's a patient portal associated with electronic health record. Patient portals are ideal in many respects, but there are some stopgaps that can make this data collection method problematic. Patient portals require registration, they require an ability to navigate the system, and not all patients want portal access due to things like privacy concerns. Ideally, patient-reported outcomes should be captured or be able to be captured through multiple data platforms. And when a patient portal is used, we recommend that enrollment in the patient portal be maximized by making registration easier, making the benefits of enrollment clear, and by providing information on privacy to help patients who have those concerns. From a design perspective, the patient portal should be easy to use and to navigate. Ideally, patients should be provided with an in-clinic data collection option so that they are not relying solely on a patient portal, which they may be having difficulty using remotely. Another common concern is that patients may get too many patient-reported outcomes and may suffer from what some call survey fatigue or PRO fatigue. In systems where patient-reported outcomes are being used across the enterprise, there is some concern that patients who are seen in multiple clinics may be asked to complete the same or different patient-reported outcomes in each clinic. Some patients have frequent appointments and may get multiple requests to complete PROs if the trigger is a clinic visit. Our recommendation to help mitigate this concern is to implement an assessment coordination and logic. Critical to this is local leadership for the patient-reported outcome data collection that facilitates a shared pro content across service lines and sets limits on what can be added. It's also important to consider a logic to prevent administering the same patient-reported outcome measure too frequently. Funding for this tutorial was provided by a grant from the National Center for Advancing Translational Sciences at the National Institutes for Health. Thank you.